Place the device on a sturdy, secure table, preferably on the same level as the patient. Secure the oxygen bottle to prevent accidents, in this case with the help of the bottle holder. Now install the oxygen device pressure regulator securely on the bottle. Then open the bottle by twisting clockwise. In the rear, attach the oxygen terminal to the oxygen device using a rapid action coupling. Plug the power cable into the main socket behind the device. Then press the power switch from 0 to 1. The Enter key blinks at 1-second intervals. Press the key. The oxygen device fills the internal supply container with oxygen and carries out a self-test. After that, turn off the bottle. The Eingabe and Enter keys flash green. They indicate the desired amount in milliliters by means of the numeric keypad and Enter key. Enter the therapy velocity from 1 to 2 milliliters per minute. This data is then taken over by pressing the Enter key. The rinse key flashes and is confirmed. The patient hose is now filled with oxygen. Insert the authorized bacteria filter into the metal flange and then attach the approved infusion set. The words rinsing phase appear on the display together with a progress bar, which indicates the amount of rinsing volume, 1 to 100%. This process lasts 1 minute. During this time, the therapist attaches the tourniquet and lays out swabs, disinfection spray, as well as adhesive tape, and checks the patient's arm for a suitable vein. After the rinsing phase, the device switches automatically to the preliminary stage with 8 milliliters per minute. The start key flashes at 1-second intervals. In addition to that, the pressure in hectopascal is shown in the middle of the display. At the left, the amount of therapy designated for the patient can be seen. Disconnect the sealing cap from the infusion needle and puncture the vein. Some blood will flow into the cannula tubing. Remove the tourniquet and the oxygen will push back the blood column completely. As soon as the blood column has been forced back into the vein, the start key must be pressed immediately. The rate of flow of 8 milliliters per minute is then reduced by the pre-selected rate of flow of 1 to 2 milliliters per minute. That triggers off the insufflation. In this example, you see a rate of flow of 1 milliliter per minute. As a rule, the venous pressure of the patient is somewhere between 10 to 35 hectopascal, as for example 11 hectopascal shown in our procedure. If the cannula tube isn't properly inserted, and the pressure shown in the middle of the display rises above 60 hectopascal, a pressure switch reduces the amount of pressure and a signal can be heard. The insufflation continues with the reduced flow until the remaining amount reaches the 0 mark and a signal sounds in 4-second intervals. The following image now appears on the display screen. By pressing the stop key, the signal tone is turned off. The oxygen device resets itself automatically, ready for a new treatment. Now remove the injection needle and dispose of it together with the filter in a suitable waste container. Look after the patient's puncture site. If no further treatment is necessary, turn off the oxygen device by means of the mains switch.